in-hospital infection, rectify relevant issues to prevent in-hospital and cross-infection as well as spread of the virus outside the hospital. The communities should exercise close management. People under observation should not go outside, and areas of designated observation should prevent cross-infection. Strengthened screening should be conducted on key groups. We should conduct health surveillance and loophole management. Business resumption should be based on good prevention of epidemic. The work sites and plants should exercise close management. The dormitories, canteens, and restrooms and relevant personnel should pay attention to epidemic control. The Dragon Boat Festival is about to come. We should keep in mind the stern situation currently and do a good work on epidemic control and prevention and arrangement of the holidays. We should exercise strict management on prevention and control. We should continue to take strict measures on outbound travel management, ban people from medium and high-risk districts and township and people related to Xinfadi market from leaving Beijing, and other people should not go outside Beijing unless highly necessary. For those who have been outside Beijing, they should report to the local authorities and prevent the epidemic control. We hope to have your understanding so that we can overcome this epidemic. Today we have invited the heads of the Publicity Department of CPT, Beijing Municipal Commission, Beijing Municipal Culture and Tourism Bureau, the Municipal Health Commission, and China Railway Beijing Bureau Company and the CDC, as well as expert group members of the NHC to brief you about relevant information. Let me introduce them. They are Mr. Wang Jiequn, Vice Minister of the Publicity Department of Beijing Municipal Commission, Mr. Zhou Weiming, Tier 1 Inspector of the Municipal Culture and Tourism Bureau, Mr. Zhang Hua, Vice Head of the Inspection and Quarantine Team of Municipal COVID-19 Prevention Control Leading Group, and DDG of Municipal Health Commission, Mr. Cui Wei, Epidemic Control Office of Passenger Transportation Team Head of Beijing Bureau of China Rail, Zheng Xiaopeng, Head of the Municipal CDC, Li Fengqing, member of the expert group of National Health Commission, and head of the microorgan lab of National Food Safety Risk Assessment Center. Now I'd like to invite CDC head, Mr. Zheng Xiaopeng, to brief us about the cases and epidemiology investigation, as well as the disinfection work. Good afternoon, everyone. I would like to brief you about the newly confirmed cases on 22nd of June. On that day, we have 13 new confirmed cases, male 9, female 4, average age 37, the youngest 8, the oldest 57, 6 in Fengtai, 3 in Haidian, 3 in Daxing, 1 in Xicheng. I'd like to give you some more detailed information. According to the epidemiological survey of Fengtai, case 1, female 51, living in Panjiamiao, bungalow of Fengtai district. He is working at Xinfadi. He has no fixed stand, doing wholesale. From June 8th to 12th, he route scooters to the market. It has not been outside after 9. On the 13th, he went to Xingong Wanda Plaza and the Yonghui supermarket. From 14th to 21st of June, he was at home, and she developed temperature on the next day. The temperature is 37.8 degrees Celsius, and he was sent to the hospital by the ambulance, and he was confirmed on the same day after receiving NAT. Case 2, male, 20, living at Fengtai District, Lugouqiao Township. He works at the noodle restaurant, and the materials were imported from Xinfadi market, and the customers are many workers at Xinfadi. On June the 1st and June the 12th, he went from home to the restaurant by taxi. And on 13th, he went to a car shop to buy a car, and returned home at 16 hours. On 14th, he rode scooters to the traffic vehicle administration to handle relevant procedures. And he stayed at home since June the 15th. And on the 20th, he began to cough and was sent to ambulance. It was confirmed on 22nd. Case 3, 40, male, living in Fengtai District. He worked at Laocheng Igor restaurant. He went to Xinfadi on the 8th and 11th of June. And on the 7th, 17 hour, he went to Hebei and then had a meal there. He didn't have close contact with others. On 10th, he went to Hebei Guan Chengbao Garden and drove back home. And on 13th, he went to get a U-key at shop. And on the 16th, he went with his wife to Yuan Hospital on bike, and then went with her wife to the sampling area. And his wife didn't have any close contact with others. And on the 20th, the NAT was positive, and he was sent by ambulance to the hospital and was confirmed on the 22nd. Case 4, male 8. He was a close contact of case 3, and he was tested positive on 21st and was sent to hospital, to Fengtai Hospital, and was confirmed on the 22nd. Case 5, male 56, living in Fengtai Huaxiang. He works at Xinfadi. His business was about dumplings and packaging fruit. On 12th, he was sent to the observation area, and on 18th, he had a sore throat, and on the 20th, the symptom developed. He was sent by ambulance to hospital on the 21st, and later to Ditan Hospital. NAT test positive, and on 22nd, confirmed. Case 6, male 57, living in Fengtai District. He works at Xinfadi Market. On 10th, 12 hour to 14 hour, he went with his friend for lunch at Jingxing Hotel in Fengtai District, and went with his friend to Daxing Airport to deliver the goods, and went back on 18th hour. And at night, he was having dinner at the Laozheng Huimian restaurant. And on 11th, he felt fever and went back home with scooter. And on the 16th, he was sent to a designated observation area as close contact, and he began to develop fever on the 18th, and on 21st his symptom developed and was sent by ambulance to hospital in Fengtai and later to Ditan Hospital. NAT positive. He was confirmed on the 22nd. According to the CDC of Haidian, case 7, female 24, living at Haidian District, Tiancun Lu. And he was a close contact of a confirmed cases on 21st. She works for a technology hotel in Xicheng district. On 15th, he received the notice from the employer asking her to stay at home for 14 days. The NAT test was negative on 18th. On the 20th, she had a sore throat but did not go to doctor. On 21st, she was sent by ambulance to a hotel for quarantine as close contact of case 8. And the 22nd, she was sent to fever clinic of Haidian Hospital, and NET was positive on 22nd and was confirmed on the same day. Case 8, male 8. He also lives in Haidian district, Tianchun Road. He was a close contact of the confirmed cases of 21st. He was sent on 21st to a designated quarantine area with case 7 and his grandma. And on 18th, he developed fever. On 22nd, he was sent with case 7 by ambulance to Haidian Hospital. And NET was positive on 22nd and was confirmed on the same day. Case 9, female, 31. She lives in Haidian district. The employer was Tiankou Supermarket, Yongdianlu branch. It was a close contact of the confirmed case of the 21st of June. He went to Yongding Road, 70th courtyard on the 12th, and didn't go out on the 17th, and went to a supermarket on 18th. On 21st, he went to 301 hospital for NAT and was sent by ambulance to quarantine area as a close contact of the confirmed case. And on 22nd, she did not feel comfortable and was tested positive and was sent to Haidian Hospital for quarantine. And on the same day, tested positive and confirmed on the 22nd. According to CDC of Daxing, case 10, male, 55, living at Daxing district, employer, a food company in Daxing district. It was a close contact of the confirmed case on the 19th. He went shopping on the 18th and stayed at home on the 19th, and went to her son's home without going into the community to ask his son to repair the handphone, and stayed at home on the 20th, and then went to the employer and was sent to the quarantine area, and NET tested positive on the 21st and was sent by ambulance to the Daxing People Hospital on 22nd and was confirmed. Case 11, male, 45, living in Daxing district, Huangcun area. The employer is a food company. He was a close contact of the confirmed cases on the 15th. He went to Hualian Life Supermarket on the 17th and stayed home on the 18th, and had a walk for 15 minutes on the 19th, and received a notice on the 20th to have quarantine, and he drove to the plant and was sent to the quarantine area. He was tested positive on 21st and was sent to Beijing Daxing People Hospital on the 22nd and was confirmed on the same day. Case 12, female 40, living at Huangcun Township. She also works for the food company. On the 16th, the NET was negative but developed fever on the 18th. He went to Daxing People Hospital by scooter and was diagnosed as respiratory infection. On the 21st, NAT positive. She was sent by ambulance to Daxing People Hospital and was confirmed on the same day, according to CDC in Xicheng District. Case 13, male, 46, living in Xicheng. On the 7th, he went to B1 of Xinhuadi Market and bought food on Stat 7 and went directly home without going out. He was at home from 16th to 20th and NAT positive on the 20th. He was sent by ambulance to Ditang Hospital and was confirmed as asymptomatic virus carrier on the 20th and was confirmed as a new case on the 22nd. I'd like to report you about the two cases that were confirmed on the 21st. According to Fengtai CDC, case 1, male 39. She lives in Fengtai District and works for a food company in Daxing. On the 15th, the plant stopped operation because of confirmed cases, so she went to the plant to clean up the plant and went back home for quarantine. On the 17th, the NAT tested negative. On 18th, she went to a hospital in Fengtai District and was suggested to have home quarantine. And on the 19th, her temperature was 37.8 and she reported to the community and was sent to the local hospital by ambulance and was tested positive and confirmed. According to Chaoyang CDC, case 2, male, 47, living Xiaohongmen area, is a service personnel. He delivered food from the 1st to the 17th every day, sending 50 orders every day, working hours from 7 to 21 hour, and then drove scooter back home with her wife. On the 18th, he went shopping at Nanchengxiang in Fanggu Road, Fangzhuang Market, and the Xiaocun Food Market. He did not receive any orders on that day. And on 19th, he went to 每日优鲜南城乡老家肉饼果多美 to take orders. And he went shopping at the supermarket near home and food stand in the evening. On the 20th, he went to 果多美方庄 branch, 每日优先顺4条 branch. And on 21st, he was sent by ambulance to Chuiyangliu Hospital for screening and was confirmed. I'd like to remind you that this is a crucial moment of epidemic control. Please wear your masks and do good protection and prevent gathering and maintain over 1 meter of social distance. Please pay attention to your hand health, hygiene, and wash your hands when you go back home to stop the spread risk. For employers, they must do a good work on control and prevention and health management of the employees, to do health survey for employees. We suggest staggering peak in having meals and go to work, and take the NAT in orderly manner and keep distancing. Do not gather. So long as we can do this, we will reduce the risk of infection. This is what I want to say about the cases. Now I'd like to say something about the disinfection at food market during the epidemic period. We know that the farm market disinfection is very important in stemming the virus during this period. The CDC has formulated the guidelines on disinfection so as to help the farm market do a good job on disinfection. The key area of the farm market is the aquatic product and the meat product selling area and the public areas. Other areas should also have disinfection. The focus should be the touchable surface such as ground, table, vehicle of transportation, and scales. The disinfection measures should be differentiated. We should select highly efficient and reliable disinfectant to ensure its efficiency. For example, for the aquatic and meat selling area, the ground, stand, and chopping board, the scissors, and the scales. For them, we should use 1000 mg per L chlorine-contained solution. And after 30 minutes, we use clean water to wash it. For the refrigerators containing aquatic products and meat selling areas, after the food is gone, we should cut the power and let the temperature return to room temperature and use 2000 mg quaternary ammonium salt disinfectant solution. After 30 minutes, you use clean water, or we can use 75% alcohol to disinfect for twice. For outer surface, 1000 mg chlorine solution. After 30 minutes, use clean water to wash it out. For vegetable and fruits and other selling areas, the measure is about the same, but the concentration can be 500 mg. For public area, we should pay attention to places that might be polluted, such as the ground and walls, the handrail, the scale. For the ground and the wash basin, the door handle, and the tap. We should also pay attention to the mop and other cleaning tools. We must use chlorine-containing disinfectant. We must pay attention to the following key points. First, we have to increase the frequency of disinfection according to the passenger flow. Second, we should pay attention to the proportion of the disinfectant. For example, for the 8-4 disinfection solution, it's only 5% of the chlorine. 5% is 50,000 mg. For farm markets, we mainly use 500 mg to 1000 mg. That is, we can use 10 mg of the 8-4 disinfectant solution with 1 liter of water, or 2 bottles of the bottled mineral water. If we want to use 1000 mg, then we use 1 cup of the A4 disinfectant original solution with 500 mg of water, or 1 bottle of mineral water. Third, we must ensure that the disinfection period is no less than 30 minutes. Fourth, we must cover all areas of disinfected areas. Fifth, for disinfection personnel, we have to do good self-protection, such as wearing protective gowns and using one-off protective masks and gloves. Market disinfection should be conducted with the cooperation of business owners and managers. The stand owners should disinfect their own stand, and the managers should be responsible for the disinfection of the public areas, including the public toilets and the ground and surface of public areas. And third, the market managers should pay attention to the routine check and quarantine efforts of the disinfection and keep a good recording. For the specific requirement, I'd like you to refer to our guidelines of the farm market during the COVID-19 period on our website. We have 36 guidelines involving hotels, markets, restaurants, old age caring house, public facilities, and building sites, and pubs, etc. Thank you. Thank you, Director Zheng. Now I'd like to invite DDG Zhang Hua of the Municipal Health Commission to brief you about NAT. Good afternoon. With the development of the outbreak in Xinfa D market, the NAT is going on in an orderly manner, and our citizens have participated in the test. This work is highly important, especially in early detection and early quarantine of the virus carrier to stem the channel of transmission. I'd like to give you the latest development of the NAT. 3 points. First, we've ordered the NAT screening in good order. We've highlighted focus and carried out a category-based screening. From the 12th to 20th of June, we have taken sample on 2.9 million people. And the testing number is 2.3 million. At our peak, there are 480 sampling sites, sampling places, and 2,422 sampling sites. Hospitals at different levels, the local community service centers, and testing institutions and CDCs have sent 7,400 people to participate in the sampling. Second, we have increased our ability of testing. We have ensured quality and safety, increased the volume of testing and our ability of testing to ensure that all eligible should be tested and all that are willing to have the test should be tested. First, we have enhanced the capacity of our medical institutions. All medical institutions at above level 2 should have the ability to do the testing. Second, we have made good use of the strengths of the third-party testing institutions to increase the testing abilities. So far, the daily testing ability increased from 40,000 to currently 300,000 per day. So every day we can test over 1 million people if we do the hybrid test. So we're moving to the fast track. Third, we're ensuring good quality and safety. We highlight the speed and the accuracy of the test, and about safety of the lab. To this end, we have put the experts of the labs to develop a team of the quality inspection and formulated the measures on safety management, covering sampling, packaging, transportation, testing, and result reporting. We selected these health supervisors who stay at the third-party testing institutions and carry out on-site quality, capacity, speed, and efficiency supervision program and campaign. They've covered all third-party testing institutions. We have set up appointment mechanism to urge the testing agencies to carry out their responsibilities, increase the efficiency and ensure efficiency of the testing quality. Well, this testing situation is still quite complex. Hundreds of thousands of medical personnel, policemen and community workers and volunteers and government officials are working at frontline. They have ensured the orderly and normal and safe process of the NAT. I'd like to express my heartfelt thanks to all those who are working at the frontline and all our citizens for their understanding and support. Thank you, Mr. Zhang. Now I give the floor to Mr. Wang Jiequn, Vice Minister of the Publicity Department, to brief you about the Dragon Boat Festival entertainment activities. As you know, we are having the Dragon Boat Festival. I'd like to brief you about the cultural activities of the Dragon Boat Festival activity. Well, because of the epidemic, we will move offline activities to online. While consolidating and deepening the theme of the cultural activities and brand building, we will try to build various forms of warm activities online, which is highly interactive, highlighting the festive atmosphere. This year, we have 8 main events, such as online Dragon Boat competition, the PK of zongzi dumpling packaging, and the reciting event of the festival, and various kinds of online shopping, online traditional opera, singing, and various kinds of food tasting online activities. Altogether, 6 categories and over 70 kinds of cultural activities will be held, involving 32 websites. It includes culture, integrating with tourism, consumption, sports, science and technology. This year, we will highlight 4 characteristics. First is health, good health. The core of the festival is good luck and good health. Well, it contains a lot of knowledge of epidemic prevention. Now we are receiving the test of COVID-19. Proper epidemic control and praying for health is what people need. Therefore, we highlight the theme of good health such as healthy way of life. Second, we try to go traditional. We will develop the traditional content involving history and culture of the festival, such as the 粽子 dumpling, the 艾铺, which is a kind of plants, and a dragon boat competition, and in memory of Qu Yuan, a great literature writer, to guide the active participation of the citizens. And the third is the sense of time. We will disseminate the significance of the festival and the patriotism and the spirit of cooperation, especially the spirit of joint efforts against the epidemic during the epidemic control period. Fourth, we will highlight the participatory nature of the activities. We will use family as a unit to increase the interactiveness and educational sense of the activities, so that this cultural activities will promote social and economic development and deliver happy life to the people. I wish every one of you a healthy, safe, and harmonious Dragon Boat Festival. Thank you. Now I invite Mr. Zhou Weiming to brief you about the epidemic control and the activities of the Dragon Boat Festival. The Dragon Boat Festival is coming after Beijing's emergency response was upgraded to level 2 under the general requirement of preventing inbound cases and local transmission. In the Dragon Boat Festival holiday epidemic prevention control, on top of routine prevention and control measures, we will adhere to the policy of safety, stability, quantitative restriction, booking staggering the peak, to ensure good epidemic control and safe, orderly, high quality and high efficiency and civic holiday tourism market, and make the Dragon Boat Festival holiday a healthy, orderly, and reassuring holiday. During the Dragon Boat Festival holiday, in order to ensure the park, the scenic area, the rural homestay facility places implement the prevention control measures, and to keep the scenic and non-scenic spots where visitors may gather, let people feel secure, healthy, and reassured when they go out. We will adopt the following epidemic prevention control, security control, and market regulatory measures. First, enforce strict epidemic prevention control measures. According to the level 2 response, the prevention and control guidelines for hotels, parks, scenic spots, and rural tourism business units have been upgraded, and all prevention control measures should strictly follow to stamp out the loopholes and risks. The public is advised to travel with caution and avoid gatherings. We should take good personal protection while going out, wear masks, wash hands frequently, and maintain a social distance. Second, strictly control the areas open to tourists. We'll open the outdoor part of the scenic spot strictly according to 30% visitor number restriction, and temporarily close the indoor part of the scenic spot. We will continue to suspend inter-provincial travel and airport plus hotel business of travel agencies. We only open the business of Beijing citizens touring Beijing to local travel agencies, and will not accept group tours by people from the medium and highly risk areas in the city. Cultural venues, such as venues for performances, entertainment venues, and online services, will remain closed. Municipal and district libraries, museums, art galleries, and other indoor public places are required to make time of use appointment and limit visitor flow by 30%. The large-scale offline cultural tourism activities planned to be held on the Dragon Boat Festival will be suspended. Relevant activities will be many held online to prevent gathering. Third, strictly enforce the quantitative limits, reservations, staggering peak. In light of the extraordinary epidemic prevention control period in Beijing, we will continue to put prevention control first, open up a limited and orderly manner, and prevent disorder. We will urge all park scenic spots, rural homestay, and rural tourism folk businesses to limit reception, strengthen time-sharing reservation, realize the staggering peak services. Citizens and tourists are required to make an appointment in advance to visit the city's parks, scenic spots, to stay in rural homestays. Fourth, heighten responsibilities of business entities, hotels, parks, scenic spots, rural folk households of rural tourism, as well as libraries, museums, art galleries, and other that are open, must strictly implement the temperature measurement, check house code, properly wear masks, maintain social distance, keep places ventilated and disinfected, conduct health monitoring and management using serving chopsticks and spoons, ensuring dining in prescribed areas, waste sorting, and not providing disposable supplies and tableware unless needed. People from middle and high-risk areas, inbound personnel, and market staff in the city should not stay in hotels and village homestays or visit scenic spots within 14 days. People in low-risk areas who want to stay in hotels and rural homestays should show no abnormality on their health kit. The hotel will temporarily suspend group dining activities. Swimming pools and indoor fitness places will not be open for the time being. Parks, scenic spots, and rural folk households of rural tourism, libraries, museums, art galleries should set visitor limits, time-sharing booking, and staggering peaks, and to implement dynamic control on the number of employees for possible large passenger flow, to provide remote thermal tips and fast-track diversion such as flight cluster aggregation risk. Rural homestay facilities in medium and high-risk areas should be suspended if they fail to meet the prevention control requirement. Fifth, strictly control travel safety. Should strengthen the flow management, strictly prevent stampede and other safety accidents. Increase checks on large amusement facilities, special equipment, high-risk tourism projects in the scenic area, as well as fire and flood prevention. We should strictly enforce flood season scenic area service rules, strengthen flood season risk prevention in the places and rural homestay facility against torrents, rockfall, landslide, and debris and other safety problems. We will ensure that the safety of travel agencies, hotel, parks, scenic spots, and rural homestays and rural tourism folk households in transportation, fire prevention, flood control, food, catering, and accommodation hygiene. Travel agencies should do a good job in the safety assessment of tourist routes in the city during the flood season. Tourist buses, especially the qualification of chartered buses and drivers. Travel safety alerts, safety emergency plans, and other safety work. 6. Strict management of non-scenic spots. It's also necessary to strengthen on-site epidemic prevention control, and evacuation services for parks, areas near scenic spot, internet-famous sites, and scenic rivers, road edges, spaces, and other non-tourist spots where tourists may gather to prevent unregulated parking, barbecue, littering, and gathering. 7. Strictly regulate the tourism market. During the festival, the unlicensed tourism and price hikes will be punished in the city. Key tourist areas, major parks and scenic spots, and internet-famous places, boutique, village, homestay facilities, etc. We'll carry out supervision and inspection to crack down on and expose violations. At the same time, we'll strengthen the complaint handling to quickly and effectively resolve tourism disputes. 8th, we'll strictly supervise and conduct inspections to implement the overall supervision responsibility of prevention, control and safety of the local government, and professional supervision responsibility of functional departments, and the main responsibility of cultural and tourism units. The prevention, control and safety supervision and law enforcement inspection of hotels, parks, scenic spots and rural homestay facilities, libraries, museums and art galleries will be strengthened. For problems found, the supervising and responsible units should make rectification within a time limit. 9th, we'll ensure quality of public tourism services. We will strengthen the publicity and guidance for citizens and tourists to travel during the Dragon Boat Festival holiday, to release information on tourist tips to citizens and tourists. The main reminder includes no booking, no travel. Citizens are advised not to travel abroad or outside Beijing. Information such as regular epidemic prevention control measures, list of open scenic spots, safety risks in scenic spots, travel weather, and traffic monitoring, forecast and early warnings. Big data is used to guide citizens to choose travel routes, time slot, parks and scenic spots in an orderly manner, to travel at different times, enter parks at different intervals and visit at staggering peaks, enhance their awareness of personal safety, and all reception service units are required to provide safe and quality services, absolutely put an end to random price rises, and effectively improve the tourist experience. I'd like to call on all of you to strengthen to consciousness of ecological conservation and rule of law, waste sorting. Leave no waste behind when travel to protect the environment, observe public order and take good care of cultural relics and the public facilities, so as to jointly create a safe, civic and harmonious environment for holiday tourism. Thank you. Thank you, Mr. Zhou Weiming, for your briefing. Now I invite Mr. Cui Wei, Head of the Passenger Transportation Group of Epidemic Control Office of China Railway Beijing Group Co. Limited. Good afternoon, friends from the media. According to Level 2 response, emergency response, and policies and measures on strict management of outbound travel from Beijing, 4 categories of people and people with fever, those who have been to Xinhuadi market since May the 30th and have close contacts with the market staff, people in places of medium and high risk areas are banned from leaving Beijing. Other people, in principle, should not go outside Beijing unless highly necessary. If they need to leave Beijing, they have to have with us the certificate of NAT negative within 7 days. The Railway Department pays close attention to the relevant epidemic control and prevention work in conjunction with Beijing municipal government, and send information to the society without any delay, and decides that for the valid ticket bought before 24th hour of the 16th, coming to an out of Beijing, they can get refund free of charge. And for high-risk groups, they will be subject under high restrictions. We will strengthen the temperature check for people before entering the train, and see their producing the NAT certificate, and conduct the onboard health management measures to stem the spread of the virus as well as the spillover effect. Because of the outbreak of the Xinhuadi market, all of a sudden the measures have been introduced for key groups of people, key areas, and key fields for nucleic acid test in Beijing. For those people who are from the low-risk areas and did not have time to conduct NAT or cannot get the result for the time being. Also, in accordance with the notification of the State Council Mechanism of Joint Epidemic Prevention and Control on the Health Management Service of COVID-19 concerning people living Beijing. For those people who live Beijing but cannot